guys. So this one worked out pretty good. So pour up a quick stone model, right? You put the thermoplast on it. So you put the thermoplast in it, and there's a couple little techniques, some Vaseline and otherwise that you'll put on there. But it comes in and snaps on, right? That little T-bar, with the fiduciary markers,
right,
goes in. That designs your hole, right? And then the T-bar comes out. Once this is milled, this snaps in, and it has a little orientation groove. So you can only put it in one way. That snaps in right.
So this was milled on the Sarek?
On the Sarek guide. Yeah, this is Sarek, on the Sarek machine. And then the problem with this is sometimes you get those undercuts, and so we're always busting teeth.
Yeah.
Right? So we're busting teeth on models. You pull it off, you bust the tooth that's still stuck in here. You just go in and do a little relieve, a relieve on that.
Pop it out.
And then, but the girls are always very timid to come back for the scan, the Galileo scan. Dr. Bull, you come do it, because they don't want to ever have to cut it off. Knock on wood, we have not had to cut one off in 2 years, but that's the process on doing that. So we've already tried it in. Renee, so come in and find yourself a spot. Come in tight. We're going to leave that light off, Angie, just so that the filming. A couple of you want to come over on the other side with the assistants. Get into where you can see and have it so you don't have any if you have. This kind of reminds me of one of my twins. So I had 2 sets of twins.
Oh, wow.
Right, my first set of twins, the doctor's like, "Hey, we're doing C-section. You want to be part of this?" I'm like, "Yeah, I want to scrub in." Right? He goes, "Right on." So they got the veil on her right here, right, so she can't see anything. They're getting ready for surgery, and I'm like, "Yeah," and I put my hand up on it. I want to see. He goes, "You see this?" I'm like, "Yeah." He goes, "Don't touch me." I'm like, all right, backing off. I'm just going to look here then. I thought he was like bringing me into the thing. He's like, "No, don't touch me." But you can touch me. Push me out of the way. Want to see what you want to see? Did you hear the snap?
Nice.
So it snaps in, it's going to stay in. So what we're going to do with Renee today is just I figured out how to work with my left foot, which is, always interesting. When you're a righty, but I always surgerize with my left foot on the rheostat, because this is a left-hand setup. You guys ready? It's on. Yep, I did. Ready? So again, my assistant's telling me what to do because I've done how many times where I haven't done it right. So they always, the other day, Lulu goes, "Why do you keep telling me what I already know?" Well, just because I need to know that I know it, so that you know it. So yeah, right. So on this situation, we're going to come in here now with the Sarek guide and the hole punches. They don't quite line up quite right, but they get us close enough, right, to fit in there, like kind of what we were talking about. But we come in here. Yeah. So I'll come down and I'll feel my bone level tissue. I'm going to just kind of go. My tissue punch never seemed to go all the way through where they come up and stick in here. I don't know if you. Right. It's not like punching a hole in a green, right? Yeah. It hits there. We'll remove that. Go ahead and remove the guide.
Plug this here.
We got a surgical blade.
Here, you remove it. I'll get it.
Okay, we're just we're repositioning. Hang on.
Relax, people.
Go ahead and close. Relax. Go ahead and close, sweetie. Renee, you can close. Go ahead and close. Good. Yeah.
Okay.
We'll give you a break.
Get all the tissue out in your hole punch. You go back with a curette, and you're just
Yeah, you got it. I take a surgical blade in, hit it, and then a large carver, scrape that bone.
Removing that tissue is kind of a critical step there, making sure.
It is, because you don't want to take tissue down in with your osteotomy, right? But then that's where it kind of comes to the. If you need to open it up anymore, if you need to flap a little bit or whatever you want to do.
What's the percentage of you doing hole punches versus flap?
I'm just going to hold your jaw for support.
I used to do a lot of hole punches, right? Yeah. But the more you get into it and see the ridge augmentation and differences, the more I'm doing that modified flap. Okay, I'll go ahead and turn that on for right now, just so I can. I know this is the part I want to see. So if you guys want to look, you can see where that hole punch went.
Right.
Dr. Barros, you see that hole punch okay? Good. Angie's used to getting manhandled.
Okay.
Oh, yeah.
So I'm just going to feel around to make sure we got a good, large carver. And you'll have a couple little tissue tags, like Dr. Clark said. Suction right there for me, sweetie. But I like this large carver, nice sharp large carver. You know, it kind of does a little bit of bone profiling at the same time. Opens it up nice and gets that little bit of epithelium and granulation tissue. If you look there. So that's my site there. You can see a little bit of tissue there. Dr. Barros, you in there?
Yep, I got it.
Can you see that from there? Do you want to, it would help to have a mirror to look back on the mirror, or are you okay? You got direct vision?
I'm not afraid if you get close.
Look,
Go ahead and put the guide back in.
right through her glasses, I can see everything just really cool.
So from here, we're going to move into the osteotomies. Again, we talked about undersizing the osteotomy. I got a 4.3 is what I've designed to go in here. So we'll start off with the 2.0. Good. And I'll always check out of habit from making mistakes of going into the mouth, is I always double check and make sure that what's 2.0 and what here, because you can't always see what's on here, right? We'll go in there. If you look here, so this is one of the different things with CEREC Guide 2, and we can spend some time, we won't spend a whole lot of time on it, but you're designing your guide. You're determining the depth. Instead of when you send it out to these other guides, they're kind of telling you what depth you're going to go to. So I've designed the depth, okay, and in doing that depth, what's called the D2 setting, I've got 25 millimeters, okay? 25 millimeters is the top of the guide to the bottom of my osteotomy, okay? And the one thing that's an advantage of doing this system with CEREC and no bell drill pieces is I just go through. So I always have a little bully gauge. I'll set it out to 25, which I do it every time just because I don't want to ever, think. You come in here, I look at it. I'm at the fourth one, right? Mm-hmm. So that's where I'm going to be going to do my osteotomy. I'll be dropping down to that fourth tick mark. And completing that osteotomy all the way through. So now there are times where I sit there and you'll double guess yourself. You've got the pins. You can always do the osteotomy, put a pin in it, take an x-ray, and confirm, yeah, I'm 2 millimeters shy of my osteotomy. If you look at this osteotomy, if you look at this here, we go through, we're looking at our nerve. Our nerve's right there. Our nerve's actually coming down underneath. What's interesting on the 3D, and I'll show you in my office, is that nerve comes from that, the buccal, the mental foramen, does an anterior loop, and then comes back. When it does that, the implant, if you look at it side by side, looks close. When you take it axial, it's like we're way lingual to it. You're not anywhere really close to it. So you don't have. So it really eliminates a lot of the fear factors, I guess, is the term.
All right, I'm gonna hold your jaw again.
Open real bit and get in there. So this is one of the fun things here. You learn with time. You can come in, get that in there, and then wiggle that back down now. So open just a little more and get that there. Here we go. Get the free pushing right, so you get no resistance, so you're not torqued going in any angle. And you always want to pump. I'm not getting much water in that.
I don't think they are.
You want to unclick that one? Did this one not unclick? So we had water in the line then.
Well, we
Come on.
earlier, that's why
There we go. So what's the problem with drilling without water? Yeah, that blood turns into a great friction, right? So I'm looking at that. I go back down. Now we're at 1, 2. And I try not to put a lot of pressure on the patient's jaw. Notice Andrew's holding it there for me. You notice when you get through and get to that other soft bone, that tip goes a lot easier. Good.